Hello everyone, I'm Kibin Alleyne and today is Tuesday, September 26th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Health professionals across the country acknowledge September as Infant Mortality Awareness Month. According to the CDC, infant mortality rates are an important marker of the overall health of society. Joining me to discuss infant mortality and preventative action is Professor of Family and Social Medicine at Einstein College of Medicine and Project Co-Director for Bronx Healthy Start Partnership, Dr. Hal Strelnick. Doctor, thank you so much for joining me.
Thank you for having me.
Now, just for those who may not be aware, could you just explain what infant mortality is and, what does that name actually mean?
Infant mortality is defined as the death of a born child during the first year of life. And that's whether it occurs in the first hours of life or it occurs just before they turn one.
Now, what are the main causes of infant mortality?
Well, the most prominent cause are birth defects, which don't allow the child to survive. The next most common is when a baby is born early and has not had the full time to grow in the womb, and what people call preemies or prematurity, and low birth weight. And the body of the infant hasn't matured adequately to be able to survive outside the mother's womb. And that often occurs if the baby is born before the 40 weeks of a full term pregnancy.
Now, I also want to talk about sudden infant death syndrome. I know this is, if you've taken any college course regarding to like developmental health or anything like that, this was like a term I would hear a lot. Can you just explain like what that is? And why is it called sudden infant death syndrome? I think when we hear sudden, we think of certain things. So can you just kind of expand on that for me?
So if an infant dies without any apparent cause, the term is often used of sudden infant death. Now, you can't make that determination just if you find the infant has stopped breathing and has lost its life. You need to investigate all the potential causes that might have occurred to lead to that. And if that investigation, sometimes a child will get caught in bedclothing and it will lead to inadvertent suffocation. And if that's the case, that would not be considered sudden infant death. But if there can be no explanation, that is termed sudden infant death. The important ways of preventing that is how you help the baby go to sleep, how you keep the environment around where they sleep, and in particular, avoiding having any member of the household smoking in the same space, so the entire apartment, because one of the higher risk factors is secondhand smoke. That can occur and lead to this. And all of this is because of the lack of maturity of the brain and the infant's lungs to be able to continue doing what we all do, with regular frequency, is, breathing and staying alert.
So just to clarify, just because when I've heard of this term, people would like kind of associate it with like what you mentioned, like maybe having too many things in the crib that could maybe block breathing. That doesn't count as sudden infant death syndrome, correct?
That's correct.
Okay, so sudden infant death syndrome is basically just for whatever reason the baby on its own stopped breathing.
That's correct. But as I alluded to, the environment, the infant may have been exposed to secondhand smoke, and that is a potential contributor and we find that there's a higher rate of infant death in households where there are smokers.
Now, I want to talk about preventative or like basically are any of these causes preventable. I know that we only went over a few. I know when I did some research, it was a little bit of a longer list of certain things that could contribute to infant mortality. And this may be scary to a lot of parents, but what are some things, or are any of these preventable?
So the prevention really starts with the woman's health when she conceives. And that is being in the best of health is important. And things like anemia, which can often happen to an otherwise healthy woman who might be interested in the timing right for that family to have a child. Making sure that that anemia is taken care of, because the reduction of the blood means that the infant, once it's in the womb, does not get the same kind of nourishment that it needs. The other important things is to assure that once a woman knows she's pregnant, that she should be sure to begin prenatal care and supplements with vitamins, particularly the prenatal vitamins, which are necessary to have all of the vitamins that are necessary, rather than the one-a-day vitamins that you would get over the counter, and following the growth and development of the infant and protecting against problems like high blood pressure, which can be exacerbated during the pregnancy and do harm by preventing the blood flow to the infant and impair their growth. And all of this is, you want the infant to do as much growing inside the womb before the baby is delivered, and to be as mature as possible. And the prenatal care is important for that.
Now, I want to know, could genetics be a variable in regards to infant mortality, especially like when we look at certain demographics that are probably a little bit more affected, which we will get into. Could genetics be a variable at all when it comes to infant mortality?
Well, as I said before, that the most common cause of infant mortality is birth defects. And many of those birth defects are genetic in their nature. And often but it's not common. The rates of infant mortality, even in the Bronx, where it's higher than the other 4 boroughs, is only 5 infant deaths per 1,000 live births. So that's 0.5%. So it's not ever common. The problem is that it's not as good as it could be.
Right. Now, how can parents receive education, basically when it comes to prenatal and postpartum care to reduce infant mortality?
Well, most programs for parents provide the educational process of what's to come during a pregnancy, what parents can do, what the mother and the father can be involved with, and other members of the family. One of the core programs that the Bronx Healthy Start Partnership provides is prenatal education and early parenting education for mothers and their partners. And that's often part of support groups and things like the centering pregnancy, where a group of pregnant women are brought together by healthcare providers, and they learn together as they all are expecting, and the opportunities they have of providing each other support is enhanced, and it's not just the health professionals or the family.
Now, can you talk about medical home for well women visits and well baby visits? This is the first time I'm, of course, hearing about this. But what is this, and is this something accessible to people who are from lower income communities?
The medical home is the concept that of primary and comprehensive care that everyone should have. And a woman who's thinking about having a baby or finds herself pregnant, it's important to have that source of primary care, and getting the prenatal care from a family physician or a midwife or an obstetrician. That's what obstetrics is about, is having a baby, or other primary care providers. And that medical home is supposed to be the coordinating site. And the community health centers in the Bronx and many of the hospital-based clinics do seek to provide that. And New York State has a special program for medical homes for people with any kind of chronic disease or mental health condition that puts them at greater risk for not getting good medical care.
Now, I understand there's something also called interconception care. Can you expand on what that is?
Well, interconception care is kind of a fancy word for everything between having children. And one of the things that we found over the years is that if you have your second child too soon after the first baby, you put that second child at greater risk for some of the problems that we've been talking about. So there is at least 18 months between the birth of one child and the conception of the next is ideal. But there's kind of a window that is about 18 months long, so up to 3 years apart. That's the ideal time to have a second child.
Well, Doctor, I want to thank you so much for joining us and having this conversation. I learned a little bit more, and I know there's so much more to learn, but I want to appreciate you for taking the time to speak with us.
Well, I appreciate this is, as you mentioned at the beginning, this is Infant Mortality Prevention Month, and we want to make sure that every child has a chance to have that first birthday candle with their families.
Right. Thank you so much. To keep up with all the work that Einstein does, please go to their website at www.einsteinmed.com. Stay tuned. We have more open for you right after this.